Yeah, that was shoved. Hello friends. Soon I will perform a breast reduction and leave surgery on a 32-year-old patient. Our patient has given birth, is 1 meter 73 centimeters tall and weighs 80 kilograms. Her breasts are E cup. Friends, look A, B, C, double D, E, quite large, and our patient is really experiencing serious issues due to the bra. She has problems with her breasts in terms of both health and visual comfort in every sense. In a little while, we will perform our patient's surgery. Since our patient is naturally built, she wanted a C cup. So we will reduce her breast size by at least 2 sizes. This will be sufficient for her. Our goal is both to lift and to create a breast that she can be more comfortable with so that she won't have issues even if she doesn't wear a bra. As I mentioned before, our patient has given birth once. She is also considering having another child. That's why the most sensitive issue for our patient is breastfeeding. She kept asking, will I be able to breastfeed? I said, you can breastfeed. I will protect the milk duct channels. Our patient has actually been experiencing this issue since her youth, but she always had fears and worries like, I wonder if I can breastfeed. And she says she wasted 14 or 15 years like this. Indeed, that's true. In the end, friends, this doesn't shrink on its own. It's not something that changes with losing or gaining weight. It's a structural issue. In some patients, the breast is really quite large. Our goal is to reduce it as much as possible, lift it and shape it in a way that will be comfortable for our patient. There is also a difference between the two breasts. The right breast is a bit larger and saggy. By the way, the brown part of the nipple, which we call the areola. I just measured the areola, friends, it is 9 centimeters. I will reduce it a bit as well, because it is much more than it should be. I'm talking about that brown part. It definitely needs to be corrected. I can't show you now, but ultimately we will do these. Of course, our patient is asking, will there be pain? Will I experience any discomfort? Will there be any problems? All these are questions our patient is asking, to which I responded that it is a surgery I perform very frequently and that such patients recover quickly, can return to life very swiftly, and can hold their children in their arms. Indeed, our patient, friends, currently has a young child and wants to hold them quickly. There is no problem in that regard. And it is a surgery I perform frequently and is not difficult. I do not use drains. I perform it without bleeding. These are great advantages for our patient. Our patient works, but they can start working even a week or 10 days later, or if they are going on vacation, they can continue their vacation. In terms of swimming, they might need some time, but even in that sense, it might not be a problem. We will discuss this in detail with our patient during next week's checkup.